Delegates, could I ask you please to take your seats? We're about to start the 150th session of the World Health Assembly Executive Board. Delegates, if I could ask for you to take your seats, thank you.
Good morning, good afternoon, and good evening, Your Excellencies, colleagues, ladies and gentlemen. It is with great pleasure that I welcome you and declare open the 150th session of the Executive Board. I extend to you and your families my best wishes for the new year. Your Excellencies, members of the WHO Executive Board, Dr. Tedros, Director General of the WHO member states, the management and staff of the Secretariat, distinguished ladies and gentlemen, good morning, good afternoon, and good evening to you all. I take this opportunity to wish you a happy new year 2022 and send you my best wishes for good health and success in the coming year. On behalf of the Bureau and the entire Executive Board, I warmly welcome you to the 150th session of the WHO Executive Board, which is convened in a hybrid format due to the precautions necessitated by the ongoing COVID-19 pandemic. Before I move on to my remarks, I wish to convey the sympathies and solidarity of the entire WHO membership to the government and the people of the Kingdom of Tonga following the recent volcanic eruption and subsequent tsunami that has affected up to 80% of the population. It is my hope that you'll be able to soon rise from the ashes and rebuild with the support of the global community, including international organizations such as the WHO, which is closely coordinating with other UN agencies and partners to support the response. Ladies and gentlemen, since the 149th session held in June 2021, WHO member states have been engaging in intense discussions under the intergovernmental processes of the Working Group for Sustainable Financing and the Working Group for Strengthening WHO Preparedness for and Response to Health Emergencies. In this regard, I take note of and congratulate WHO member states for the successful convening of the second special session of the Health Assembly, which adopted a resolution defining the process for the development of a new international instrument on pandemic prevention, preparedness, and response. During the same period, the Bureau, on behalf of the Executive Board, held several meetings to discuss, among other issues, proposals for inclusion in the agenda of the EB 150, in addition to deliberating on the format of the governing body meetings. I also wish to update member states of the convening by the WHO Director General on 1st October 2021 of an informal EB retreat, which provided an opportunity for frank discussions amongst EB members on how the EB could be more strategic in executing its mandate as the executive organ of the Assembly. Fellow EB members, turning to this session of the board, I'm acutely aware of the substantive and complex agenda that we must cover between now and Saturday, made even more challenging by the shortened duration for the EB this year. As I mentioned in my inaugural address as board chair, I will continue to rely on your collective support, wisdom, and cooperation in order to ensure the efficient and smooth running of our board meeting. In relation to the pressing health challenges of our time, I urge the EB to spare no effort in making decisions that will positively contribute to bringing an end to the ongoing pandemic and secure a healthier and more sustainable future. As I conclude my remarks, I wish to convey the board's appreciation to Honorable Nicholas Steele, Minister of Health, Social Security and International Business of Grenada, and Chair of PBAC, for his very able leadership and steering of the PBAC discussions last week. The board looks forward to receiving the PBAC report, including its recommendations, this week. I also wish to thank the Director General, Executive Director for Governance, as well as the GBS and legal teams for their professionalism and support in preparing for this meeting. I look forward to our fruitful deliberations during the coming week, and thank you once again for your participation. In the context of the restrictions imposed in response to the COVID-19 pandemic, the Executive Board has approved the arrangements for a hybrid meeting of the Executive Board to be held. I have particular pleasure in welcoming all the Executive Board members and their alternates and advisors who are joining this meeting in person and through the virtual platform. I should like to address a special welcome to 8 new members of the board. From Colombia, Mr. German Escobar Morales. From Guinea-Bissau, Dr. Agostina Mbako Ndomba. From India, Mr. Rajesh Bhushan. From Madagascar, Professor Zeli Arivelo. From Malaysia, Kairi Jamaluddin. From Peru, Dr. Hernando Ismael Flores, and from Tonga, Dr. Sai Mai Piukala. And finally from Tunisia, Professor Ali Mrabet. Unfortunately, Dr. Sai Mau Piukala from Tonga is unable to participate in this session of the board due to the recent unfortunate events that have occurred in Tonga, which I addressed in my remarks. Dr. Sai Piukala was due to participate on Wednesday, 26th January, with in the Dr. Lee Jong-wook Memorial Prize for Public Health Selection panel, in accordance with Article 6 of the statutes of the prize. And under agenda item 22.3, foundation committees and selection panels. In his absence, I propose to have him replaced by Dr. Hiroki Nakatani for the purpose of this specific meeting of Dr. Lee Jong-wook Memorial Prize for Public Health. I've also been informed that Dr. Wahid Majrooh from Afghanistan is not present for this session of the board. Dr. Wahid Majrooh was due to participate on Wednesday, 26 January, in the Nelson Mandela Award for Health Promotion Selection Panel. And in accordance with Article 5 of the Statutes of the Award, and under Agenda Item 22.3, Foundation Committees and Selection Panels, in his absence, and in line with my previous proposal, I propose to have him replaced by one of the vice chairs for the purpose of this specific meeting of the Nelson Mandela Award for Health Promotion Selection Panel, and will consult with the Bureau on this matter. Are there any comments on these two proposals? I see none. It is so decided. I would also like to cordially greet representatives of member states, observers, the United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations, and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. I would also like to welcome our colleagues who are following the deliberations of this meeting. Special procedures. To regulate the conduct of this hybrid meeting, we shall now take up the draft decision contained in document EB 150/2 concerning the special procedures to regulate the conduct of this hybrid session of the Executive Board. May I take it that the Executive Board is ready to adopt the special procedures contained in document EB 150/2 and to apply them to this meeting? I see no objection. The decision is therefore adopted. The special procedures set out, among other things, how delegations may address the meeting. In addition, please note that, as in a physical meeting, within member states' delegations, the matter of authorization to take the floor is a matter for the delegation itself. Accordingly, and in line with the normal practice, if an alternate or an advisor who has been duly registered as part of the delegation presents themselves to speak or vote on behalf of a delegation, it will be assumed that they are authorized by the delegation to do so. In terms of procedural motions, member states wishing to raise a point of order or exercise a right of reply should do so either by raising their nameplate if the delegation member is physically present, or by sending a message to the telephone number by SMS, text, or WhatsApp, +4179 467 2870. The number is the same that member states used during other recent governing body meetings, and it may be used for points of order, requests for rights of reply, or other procedural motions only. It may not be used for any other matter. The telephone number can also be found in the practical guide for decision-making and procedural issues on the virtual system contained in document EB150/INF/1. In addition, I would like to make clear that I propose to accord the right of reply, if sought, at the end of each day. Delegates are kindly required to keep their interventions as brief as possible, and in the interest of time, it would be appreciated if interventions could be limited to up to 2 minutes. May I take it that the board is content to proceed on this basis? I see no objection. I now turn to the matter of the note verbal from the government of Ethiopia addressed to the executive board, copies of which have been provided to members of the board. This is an extremely complicated matter with political implications and outside the agreed procedural framework of this committee. Accordingly, I'm inclined to the view that this request should be set aside with respect to the board and, if appropriate, addressed by those concerned as they may deem appropriate. As I take it that this view is acceptable, let us proceed accordingly, and we move now to our next item, the adoption of the agenda. Thank you very much for your understanding. Let's now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda contained in documents EB150/1 and EB150/1 annotated. In accordance with the Rule 8 of the Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 30th September 2021 to review the draft provisional agenda of the 150th session of the board that had been circulated to member states on 30th June 2021. Proposals received from member states by the deadline of 22nd September 2021 were considered. You will find the details of the consultation and the recommendations on pages 9 to 12 of the English version of the document EB150/1. I would like to propose the deletion of the following agenda items, as I understand that they are not needed. Item 6.3, modalities of the second candidates forum. Item 19.6, amendments to the financial regulations and financial rules. And the second bullet point on membership under item 22.2, the Independent Expert Oversight Advisory Committee. May I take it that this proposal is acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? Thank you. The agenda is therefore decided. of France, I can see your nameplate is up. You have the floor, please.
Thank you, Chair. It's not about the adoption of the agenda, it's a general comment. So, Mr. President, Mr. General Director, dear member of the Executive Council, chers collègues, pardon, I switch in French. L'Union européenne travaille en étroite collaboration avec l'organisation.
Working with the WHO on a large number of subjects at a global level, as in the exchange of letters between WHO and the EU in the year 2000, intensification of cooperation without prejudice or any future conclusion on an agreement between the WHO and the EU. The European delegation has been attending EB meetings as an observer. As during previous sessions of the EB, we'd like to ask the EB members to accept that the delegation of the European Union should also be invited to participate without the right to vote in the deliberations of the subcommittees and the committees, working parties, drafting groups and other subcommittees during the 150th session of this executive board. Thank you.
Are there any proposals are there any objections to France's proposal? I see none. Thank you. The method of work and daily timetable. As you know, EB 150 has a heavy agenda with 55 items and sub-items and more than 20 draft resolutions and decisions to be examined. It is important that we hold the meetings in a constructive manner. I would like to inform you, as discussed by the Executive Board members during the informal EB retreat, EB members are encouraged to be concise when taking the floor. However, they will not be required to adhere to specific time limits. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of United Nations, and other participating intergovernmental organizations and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. I would also like to inform you that, as agreed, constituency statements by non-state actors in official relations will continue to be trialed during this meeting and will be provided on the following selected agenda items. Pillar 2, items 15.3, WHO's work in health emergencies, and 15.5, Global Health for Peace Initiative, which are being taken together. Then Pillar 3, item 17, on maternal, infant, and young child nutrition. Pillar 4, item 19.3, on sustainable financing. Constituency statements will be limited to 3 minutes and will be delivered after all EB members intermingled throughout the discussions. When we move to the agenda items considered last week by the PBAC, I propose to build on the good work of that committee by focusing our discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. May I take it that these proposals are acceptable? I see no objection. It is so decided. I propose that the board meet from 10 to 13 hours and from 14 hours to 17 hours Geneva time. Let us now review the preliminary daily timetable contained in document EB 150/div/2. Today, after our consideration of item 2, report by the Director General, we will turn to item 3, outcome of the second special session of the World Health Assembly, held to consider developing WHO convention, agreement, or other international instrument on pandemic preparedness and response. Then item 4, a report of the regional committees to the Executive Board. When we move on to the technical and health items, we will start with Pillar 2, 1 billion more people better protected from health emergencies, and take up together sub-items 15.1, strengthening WHO preparedness for and response to health emergencies, and 15.2, the Standing Committee on Pandemic and Emergency Preparedness and Response. On Tuesday, 25th January 2022, at 10 hours CET, the board will turn to item 6, post of Director General. On Tuesday afternoon, we will consider item 5, report of the Program Budget and Administration Committee of the Executive Board, followed by sub-item 19.3, sustainable financing report of the working group. We shall then turn to Pillar 1, followed by the remaining items under Pillar 2, Pillar 3, and Pillar 4, as described in the preliminary daily timetable in document EB 150/division/2. Item 20.1, prevention of sexual exploitation, abuse, and harassment, will be taken up on Friday, 28th January 2022 at 1400 hours. I understand that the proposed grouping of the items under each pillar has been shared. And I would also want to confirm that the agenda is adopted. Do I take it that the board agrees with these proposals? As I see no objection, it is so decided. I would like to draw the attention of participants on the virtual platform to the guidance provided by the Secretariat regarding correct equipment. In particular, I would like to remind all speakers of the request to use a full headset with inbuilt microphone when speaking. Headsets are important to assure the best possible sound quality for all participants, and especially to ensure optimal sound quality for the interpreters who need to be able to hear clearly in order to interpret your statements accurately. Please note that only speakers present in the meeting room do not need headsets for speaking, simply because they have the benefit of microphones that feed sound directly to the interpreters. Your compliance with this request is highly appreciated. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. If you would like your statement to be posted on the WHO website, or if you have a longer statement with the information you would like to share additionally, you may send it to the email address statements@who.int. Please note that written statements will not be included in the summary record of the meeting. This concludes our consideration of agenda item 1. Now let's turn to the next agenda item. Let us consider item 2 of our agenda, a report by the Director General, and I have the pleasure in giving the floor to the Director General, Dr. Tedros. You have the floor.
There's a glimpse of hope we all know. There's a darkness where light need to show. I'm searching for a way, oh, hoping for answered prayer, waiting for the flame of love to share.
We gather here, knowing who we are, holding hands and standing with open hearts, and reaching to a place where there are more to say.
sing.
Keep it hard and
Thank you. The video was played in relationship to my earlier comments regarding the volcanic eruption in Tonga and the subsequent tsunami, and of course, our solidarity with the people of Tonga. I have the pleasure in giving the floor to the Director General, Dr. Tedros. Dr. Tedros, you have the floor. Thank you.
Thank you, Your Excellency. It was the right thing actually to start with the nurses choir, nurses from Tonga. I visited the hospital, Viola Hospital, when I visited Tonga in 2019. And I met these nurses in person. And I was impressed by their songs, the choir. It's part of the healing process, by the way, for their patients. They help the patients through singing with the patients and so on. So I'm glad to start really with that, and our heart is with Tonga. Of course, I have something to say later. Your Excellency, Dr. Patrick Amoth, the Chair of the Executive Board, Excellencies, Regional Directors, dear colleagues and friends. Good morning to all EB members who have joined us here in Geneva, and good morning, good afternoon, and good evening to all member states, participants, and observers online. Happy New Year to you all. I welcome the new members of the board. As the chair said, we send our deepest condolences and concern, our warmest greetings, and our best wishes to our sisters and brothers in Tonga who are facing difficult days as they respond to last week's volcanic eruption and tsunami. As we speak, WHO is working with our partners to support the response, providing medical expertise and supplies. A national emergency medical team trained by WHO was deployed almost immediately following the eruption. And we're supporting them with medical items, first aid kits, tents, portable toilets, and water filtration equipment. Our country liaison officer, Dr. Yutaro Setoya, is playing a crucial role in channeling communication between the UN agencies, humanitarian partners, and the government, including through the use of WHO satellite phone, which was one of the few ways to get information in and out of the country in the first few days after the eruption. So my appreciation to our country office and also to our regional director, Takeshi Kasai, who is with us today. This Sunday marks 2 years since I declared a public health emergency of international concern, the highest level of alarm under international law over the spread of COVID-19. At the same time, At the time, there were fewer than 100 cases and no deaths reported outside China. 2 years later, almost 350 million cases have been reported and more than 5.5 million deaths. And we know these numbers are an underestimate. On average, last week, 100 cases were reported every 3 seconds. And somebody lost their life to COVID-19 every 12 seconds. Since Omicron was first identified just 9 weeks ago, more than 80 million cases have been reported to WHO. More than were reported in the whole of 2020. So far, the explosion in cases has not been matched by a surge in deaths. Although deaths are increasing in all regions, especially in Africa, the region with the least access to vaccines. So where do we stand? Where are we headed? And when will it end? These are the questions many asking. It's true that we will be living with COVID for the foreseeable future, and that we will need to learn to manage it through a sustained and integrated system for acute respiratory diseases, which will provide a platform for preparedness for future pandemics. But learning to live with COVID cannot mean that we give this virus a free ride. It cannot mean that we accept almost 50,000 deaths a week from a preventable and treatable disease. It cannot mean that we accept an unacceptable burden on our health systems when every day exhausted health workers go once again to the front line. It cannot mean that we ignore the consequences of long COVID, which we don't yet fully understand. It cannot mean that we gamble on a virus whose evolution we cannot control nor predict. There are different scenarios for how the pandemic could play out and how the acute phase could end. But it's dangerous to assume that Omicron will be the last variant or that we are in the end game. On the contrary, globally, the conditions are ideal for more variants to emerge. To change the course of the pandemic, we must change the conditions that are driving it. We recognize that everyone is tired of this pandemic, that people are tired of restrictions on their movement, travel, and other freedoms, that economies and businesses are hurting, and that many governments are walking a tightrope, attempting to balance what is effective with what is acceptable to their people. Each country is in a unique situation and must chart its way out of the acute phase of the pandemic with a careful, stepwise approach. It's difficult, and there are no easy answers, but WHO continues to work nationally, regionally, and globally to provide the evidence, the strategies, the tools, and the technical and operational support countries need. If countries use all of these strategies and tools in a comprehensive way, we can end the acute phase of the pandemic this year. We can end COVID-19 as a global health emergency, and we can do it this year. What does that look like? It means achieving our target to vaccinate 70% of the population of every country with a focus on the most at-risk groups. It means reducing mortality through strong clinical management, beginning with primary health care and equitable access to diagnostics, oxygen, and antivirals at the point of care. It means boosting testing and sequencing rates globally to track the virus closely and monitor the emergence of new variants. It means the ability to calibrate the use of public health and social measures when needed. It means restoring and sustaining essential health services. And it means learning critical lessons and defining new solutions now, not waiting until the pandemic is over. We can only do this with engaged and empowered communities, sustained financing, a focus on equity, and research and innovation. Vaccines alone are not the golden ticket out of this pandemic. But there is no path out unless we achieve our shared target of vaccinating 70% of the population of every country by the middle of this year. We have a long way to go. As it stands, 86 member states across all regions have not been able to reach last year's target of vaccinating 40% of their populations. And 34 member states, most of them in Africa and the Eastern Mediterranean region, have not been able to vaccinate even 10% of their populations. 85% of the population of Africa is yet to receive a single dose of vaccine. How can this be acceptable to any of us? We simply cannot end the emergency phase of the pandemic unless we bridge this gap. But we can bridge it, and we're making progress. Just a week ago, COVAX delivered its 1 billionth dose. In the past 10 weeks, COVAX shipped more vaccines than in the previous 10 months combined. The challenges of supply we have faced in the past year are now being replaced by the challenge of rolling out vaccines as fast and far as possible. WHO and our partners are working with countries around the clock to overcome these challenges. Excellencies, colleagues, and friends, the pandemic has been a severe disruption to health systems, economies, and societies the world over. And to much of our shared work to advance towards the 3 billion targets of the 13th General Program of Work. For that reason, the Secretariat is proposing a 2-year extension of the GPW to 2025 to give us all a chance to get back on track, apply the lessons of the pandemic, intensify investments, and accelerate progress. Even before the pandemic, the world was off track for the 3 billion targets. Now we're even further behind. That's particularly the case for our target to see 1 billion more people benefiting from universal health coverage. As a result of the pandemic, we could now be facing a shortfall of up to 840 million people, mostly in lower income countries. More than 90% of countries continue to report disruptions to one or more essential health services. The most recent WHO Global Monitoring Report on UHC shows that while service coverage has improved over the last 20 years, about half the world's population still lacks access to essential health services. And the proportion of people facing financial hardship due to out-of-pocket spending has increased. But Despite the ravages of the pandemic, we are demonstrating that with the right strategies and the right tools, we can bring some of the world's oldest infectious killers under control. On communicable diseases, 2021 was a historic year, with the WHO recommendation for widespread use of the world's first malaria vaccine, which could save tens of thousands of young lives each year. China and El Salvador were certified by WHO as malaria-free last year, and the Islamic Republic of Iran recorded 3 consecutive years of 0 indigenous cases of malaria. 8 countries achieved the 90-90-90 targets for testing, treatment access, and viral suppression of HIV by the end of 2020. And a further 20 countries are close. With support from WHO, 15 countries have eliminated mother-to-child transmission of HIV and/or syphilis in 2021. Botswana became the first high-burden country in Africa to achieve silver tier certification on the path to elimination of mother-to-child transmission of HIV. We're validating the elimination of hepatitis B and C as a public health threat in 5 countries: Brazil, Georgia, Mongolia, Rwanda, and Thailand, with several other countries nearing validation, including Egypt. Despite the disruptions of the pandemic, 86 countries globally achieved the End-TB strategy milestone for 2020 of reducing TB incidence. With WHO support, 5 countries eliminated a neglected tropical disease. Gambia and Myanmar eliminated trachoma. Cote d'Ivoire and Togo eliminated human African trypanosomiasis. And Malawi eliminated lymphatic filariasis. Only 14 cases of guinea worm disease were reported last year from 4 countries, taking us ever closer to the eradication of this ancient disease. And only 5 children were paralyzed by wild polio virus, the lowest level we have ever achieved. We now have a real opportunity to eradicate wild polio once and for all this year, and move towards a sustainable transition in countries that are now polio-free. So for polio eradication, this is the opportunity. In November, the first truly nationwide polio vaccination program in several years was conducted in Afghanistan, protecting more than 2.6 million previously inaccessible children. On non-communicable diseases, we launched a new global breast cancer initiative to reduce mortality by 2.5% every year until 2040, saving 2.5 million lives. We launched the global platform for access to childhood cancer medicines, a $200 million initiative to provide quality-assured medicines to 12 low and middle-income countries. As you know, in high-income countries, childhood cancer survival is over 80%, while in low-income countries, it's under 30%. We will do everything to narrow this gap. To support our global strategy to eliminate cervical cancer, we pre-qualified a 4th HPV vaccine for cervical cancer to increase access and decrease prices, and several more countries have introduced HPV vaccines into national immunization schedules, including Cameroon, Cape Verde, El Salvador, Mauritania, Qatar, Sao Tome and Principe, and Tuvalu. And we're working with 120 countries to strengthen, integrate interventions for hypertension, diabetes, and other NCDs into primary health care. COVID-19 has taken a heavy toll on mental health and laid bare the gaps in services around the world. WHO is supporting many countries to expand access to services, including Bangladesh, Jordan, Paraguay, Philippines, Zimbabwe, and Ukraine, where we trained health workers in primary care facilities, increasing access to mental health services. Last year, experts in mental health and psychosocial support were deployed to support scaling up of services in 18 countries and territories in response to public health and humanitarian emergencies. WHO is also supporting countries to expand access to rehabilitation services, including Solomon Islands, Nepal, Rwanda, Georgia, Jordan, and Guyana. 2021 was also a landmark year for WHO's work to increase access to medicines and health products. We gave emergency use listing to 10 COVID-19 vaccines, pre-qualified injection devices and therapeutics, and most recently, we recommended 2 new drugs for the treatment of COVID-19. The COVID-19 Technology Access Pool, CTAP, and the Medicines Patent Pool finalized its first licensing agreement for a COVID-19 serological antibody test. We established the mRNA Technology Transfer Hub in South Africa to boost vaccine production on the continent. And more than 100 member states co-sponsored a World Health Assembly resolution on strengthening local production. On antimicrobial resistance, a recent study estimates that more than 4.9 million deaths were associated with AMR in 2019, making it one of the world's leading causes of death. Despite disruptions due to COVID-19, a record 163 countries have responded to the fifth of tripartite AMR country self-assessment survey on the status of their AMR response. The survey shows that less than 1/4 of AMR national action plans are costed and funded, so WHO has piloted and launched a costing and budgeting tool to support the implementation of national action plans on AMR. The Multi-Partner Trust Fund for AMR, established in 2019, is successfully dispersing funds for global and national activities in already 9 countries. 2021 also saw good progress in our efforts to see 1 billion more people enjoying better health and well-being. This area has enormous potential. We estimate that at least half of the global disease burden could be prevented by supporting safer and healthier environments that allow people to make healthy choices and adapt healthy behaviors. Our current estimates suggest that 900 million people will enjoy better health and well-being by 2023, making the GPW target within reach. However, these gains were mostly in high-income countries, and stark and immense inequalities within and between countries highlight the need to read this achievement with caution. Nevertheless, we have many successes to be proud of. Tobacco use continues to decline. In line with the WHO Framework Convention on Tobacco Control, we worked with 90 countries to reduce tobacco use last year and launched a global campaign to encourage at least 100 million tobacco users to quit. 60 countries are now on track to achieving the voluntary global target of a 30% reduction in tobacco use between 2010 and 2025. As part of WHO's initiative to eliminate trans fatty acids from the global food supply, mandatory policies prohibiting the use of trans fats are now in effect for 3.2 billion people in 57 countries. In 2021, best practice policies came into effect in Brazil, the European Union, Peru, Singapore, and Turkey, while India and Philippines became the first lower middle income countries to pass a best practice policy. We have identified 23 countries to implement the Global Action Plan on the prevention and treatment of child wasting, and 57 countries have already reached or are on track to meet the 2025 target of reducing childhood wasting rates to below 5%. For the first time, the Conference of the Parties to the UN Climate Convention, COP26, included a health program in which more than 50 countries committed to strengthening the resilience of their health systems to climate risks and transition towards a zero-carbon healthcare. WHO has already assisted over 30 countries to begin this journey and will further scale this up over the next 5 years. In the past year, new legislation or regulations on the marketing of breast milk substitutes were approved in Burkina Faso, Cote d'Ivoire, Ethiopia, Kenya, Mauritania, Oman, Sao Tome and Principe, and Sierra Leone. More than 23,000 facilities in 182 countries participated in WHO's global campaign on WASH in healthcare, covering over 14 million health workers and 5.4 million beds. Since the launch of the Global Plan of Action on Road Safety in October, at least 28 countries have launched local initiatives with support from WHO. 4 countries established new laws to reduce exposure to lead paint, which causes about 1 million deaths every year. Peru, Morocco, Georgia, and Ukraine, and WHO is working with 40 countries to develop and implement lead paint laws. We hosted the 10th Global Conference on Health Promotion, which endorsed the Geneva Charter for Well-being. We hosted the Small Island Developing States Summit for Health, supporting countries who are almost at risk of the impact of climate change to create climate-resilient health systems and mobilize new resources. Together with our partners in the Tripartite Plus, we established a One Health high-level expert panel to provide policy and technical guidance to the 4 partner agencies. On our triple billion target to see 1 billion more people better protected from health emergencies, our current estimates are that we will get close to 1 billion, but the pandemic shows we need to be much more ambitious, much better prepared, and improve the way we measure protection against health emergencies. Supporting countries to respond to COVID-19 continues to be the focus of our work at all 3 levels of our organization. But of course, COVID-19 was far from the only emergency last year. We responded to 76 health emergencies, from acute crisis in Afghanistan, DRC, Ethiopia, and Tonga, to multiple outbreaks of cholera, yellow fever, meningitis, and Ebola, to protracted emergencies in Syria, Yemen, and Cox's Bazar. Through the WHO Logistics Hub in Dubai, we have provided almost $50 million of urgent medical supplies to 120 countries. The operation has increased by a factor of 40 in recent years and now includes a state-of-the-art cold chain facility. We have also taken several steps to put in place new mechanisms for future emergencies. Reflecting long-standing mandates from the World Health Assembly to strengthen pandemic preparedness, we established pathfinding initiatives with member states, such as the WHO Hub for Pandemic and Epidemic Intelligence, the WHO BioHub system, and the Universal Health and Preparedness Review, which you will hear more about later this week. These new initiatives are aligned with many of the recommendations from the various reviews and provide a solid foundation for strengthening the global health architecture to manage the risks of epidemics and pandemics. Underpinning all of these achievements is the core business of developing top quality norms and standards for which member states depend on us, and a commitment to strengthen data and health information systems to monitor progress. In 2021, we produced new guidelines, strategies, action plans, and reports across the spectrum of health challenges, from air quality to artificial intelligence, from hepatitis to hypertension, from suicide prevention to sexual and reproductive health, and much more. All of these technical products have been quality assured by our science division, which was established as part of our transformation to ensure we give you, our member states, the highest quality norms and standards, and to translate those products into impact in countries. We also launched the digitalized ICD-11, the Triple Billion Dashboard, the World Health Data Hub, and more. We used behavioral science to support the pandemic response in Zambia, Nigeria, Malaysia, and other health challenges, from nutrition to antimicrobial resistance and maternal health. We launched the WHO Academy in Lyon. Through the Global Action Plan for Healthy Lives and Well-being for All, 13 partner agencies are collaborating for greater impact in 50 countries in primary healthcare, health financing, data, and more. Excellencies, dear colleagues and friends, ending the acute phase of the pandemic must remain our collective priority. One of the greatest risks now is that we move on to the next crisis and forget the lessons the pandemic has taught us, lessons that have come at a greater price. The most important of these lessons is the centrality of health. COVID-19 is so much more than a pandemic. It is a global crisis that touches every area of life: economics, education, families, employment, business, technology, trade, travel, tourism, politics, security, and so much more. It's a very long list. When health is at risk, everything is at risk. The pandemic is a brutal reminder that health is not a byproduct of development, not an outcome of prosperous societies, not a footnote of history. It's the heartbeat, the foundation, the essential ingredient without which no society can flourish. Health is central. Our forebears knew this when they wrote in the constitution of this World Health Organization that the health for all peoples is fundamental to the attainment of peace and security, and is dependent upon the fullest cooperation of individuals and states. That unequal development in different countries in the promotion of health and control of diseases, especially communicable diseases, is a common danger. And that the highest attainable standard of health is one of the fundamental human rights of every human being. This is the vision of this organization was created to fulfill. And that's the vision for which we must continue to strive. We need a new determination, a new ambition, a new hope to fulfill that vision. Of course, the world in which we work and the challenges and opportunities we face are very different from the world in which our Constitution was written. Aging populations in some regions, a youth boom in others, searing inequalities in gender, race, and income that harm health and inhibit access to services, historic levels of migration driven by conflict, poverty and the hope of a better life, and a changing climate with profound implications for the future of health. Our challenge is to reinterpret, revitalize, and reimagine our founding vision for our modern world. Realizing this vision requires a paradigm shift in all countries in how health is seen and how health is financed. Indeed, that's why we established the Council of the Economics of Health for all last year to develop a new vision for the way health is financed. For far too long, health has been compartmentalized and deprioritized nationally and internationally. It's time to recognize that if we fail to invest in health, we fail to invest in the future. The triple billion targets of the 13th General Program of Work and the Sustainable Development Goals on which they are based remain our guide. We have made progress against the GPW, and the transformation has positioned us to deliver, but we have more work to do. In particular, our commitment in the coming year and in the coming 5 years is to dramatically strengthen our ability to deliver results in countries. Let me outline 5 key priorities for the world and for WHO as we move forward. First, to support countries to make an urgent paradigm shift towards promoting health and well-being and preventing disease by addressing its root causes. The pandemic has demonstrated that we must elevate protecting and promoting health as a top priority with significantly increased investment in countries and at WHO. The highest attainable standard of health does not only mean the highest attainable standard of care. It means keeping people healthy and preventing the need for care. It means true health care, not sick care. It requires empowering and enabling individuals, families, and communities to make healthy choices. And it requires governments to create the conditions in which health can thrive by addressing the root cause of disease that lie outside the health sector, all the determinants of health. In particular, it requires radical action to safeguard the health of the planet on which all life depends, by addressing the existential threat of climate change. Such a shift could cut the global disease burden in half, but it would also offer massive economic gains by reducing the burden on health systems and increasing the productivity of populations. The second priority is to support a radical reorientation of health systems towards primary health care at the foundation of universal health coverage. That means restoring, expanding, and sustaining access to essential health services, especially for health promotion and disease prevention, and reducing out-of-pocket spending. It means focusing on the least served, most vulnerable populations, especially women, children, and adolescents, migrants, and refugees. It means ensuring access to vaccines, medicines, diagnostics, devices, and other health products. And it means investing in a health workforce with the training, skills, tools, safe working environment, and fair play to deliver safe, effective, quality care. The third priority is to urgently strengthen the systems and tools for epidemic and pandemic preparedness and response at all levels, underpinning by strong governance and financing to ignite and sustain those efforts, concerted, connected, and coordinated globally by WHO. The decision by member states at the recent special session of the World Health Assembly to negotiate a convention, agreement, or other international instrument on pandemic preparedness and response is a giant stride forward. We urge all member states to engage in this process constructively. Such an instrument will be a vital tool, but it will not solve every problem. There are many other steps we must take together to strengthen pandemic preparedness and response and the architecture to support it. But this agreement, I hope, will be a generational agreement. That will be a game changer. The fourth priority is to harness the power of science, research, innovation, data, and digital technologies as critical enablers of the other priorities for health promotion and disease prevention, for early diagnosis and case management, and for the prevention, early detection, and rapid response to epidemics and pandemics. The solidarity trials for vaccines and therapeutics and the trials supporting the recommendation for widespread use of the world's first malaria vaccine highlight the key role WHO can play as a convener of research. And the fifth priority is to urgently strengthen WHO as the leading and directing authority on global health, at the center of the global health architecture. To continue our transformation journey to make this organization, your organization, more effective, efficient, and accountable. COVID-19 has proven that health is not just a national issue, it's an international issue. The scale of challenges we face is immense and is reflected by the breadth of your agenda this week. The needs are great, and you are right to have great expectations of your WHO. You're right to expect top quality norms and standards based on the best science. You're right to expect even more results in countries. You're right to expect a robust and coordinated international response to emergencies. You're right to expect enhanced governance, efficiency, accountability, and transparency. You're right to expect the highest standards of conduct, and you're right to expect an organization that has zero tolerance for sexual exploitation, abuse, and harassment. The thousands of talented, dedicated people around the world who are proud to work for this organization share your expectations, and so do I. They're committed not just to meeting your expectations, but exceeding them, and so am I. Just as health workers need the resources and tools to do their jobs, so your secretary at your WHO needs the sustainable, predictable, and flexible funds to do ours. So I ask member states to ensure the quality and quantity of your investments match your expectations. Entrust us with the resources to deliver the results you rightly expect. Let me put it plainly. If the current funding model continues, WHO is being set up to fail. The paradigm shift in world health that's needed now must be matched by a paradigm shift in funding the World's Health Organization. We must look to the future. We must raise our eyes and our ambitions. What do we want the world to look like in 2030? or when WHO turns 100 in 2048. We will be 75 next year. We all want a healthier world, a world in which the air people breathe, the food they eat, the water they drink, the conditions in which they live and work nurture health instead of harming it. We all want a safer world in which all countries work together to prevent, detect, and respond rapidly to outbreaks and other health emergencies. We all want a fairer world in which all people can access the health services they need without having to make life and death decisions between paying for care and feeding their families. The world has the resources. It's not because we don't have resources. We all want a world in which science triumphs over misinformation. Solidarity triumphs over division. And equity is a reality, not an aspiration. How many times have we said equity, equity, equity? It can be a reality. If there is a will, there is a way. If that's the world we want, we must start working for that world now. It will take vision and partnership. It will take negotiation, compromise, and sacrifice. Most of all, it will take hope. Most of all, it will take hope. We are one world. We have one health, and we have one WHO. Thank you so much. Merci beaucoup.
Thank you, Dr. Tedros. The floor is now open, and I would like to request that the Secretariat moderate the discussion. Secretariat, you have the floor.
Thank you very much, Mr. Chair. I recognize the United Kingdom and would like to give the floor to them. The United Kingdom, the floor is yours. Apologies, distinguished delegate. We cannot hear you here in the room. Let's try once more. Please. Distinguished delegate, my apologies. We have difficulty hearing you here in the room, although I see that you're unmuted. Yes? We are ready to try again. The floor is yours. I'm sorry. We shall come back to you in a moment to give a little bit of time to fix this technical challenge. And I recognize Ethiopia. No, apologies. I recognize EB member Kenya. Kenya, the floor is yours, please.
Thank you. You can hear me? Can you hear me?
Yes, absolutely. Thank you.
Thank you, Chair. Kenya is pleased to be delivering this statement on behalf of the 47 member states of the WHO African region. The African member states thank the Director General for presenting his report to the board, highlighting in detail the most pertinent technical and administrative updates since our last board meeting. Now in its third year, The COVID-19 pandemic continues to cause unprecedented health, social, and economic disruptions across the world, with the latest surges being fueled by variants of SARS coronavirus 2. We applaud the efforts of WHO staff and other health and essential workers who demonstrate the resilience and compassion of the human spirit each day. Chair, ladies and gentlemen, it is now evident that as long as we fail to vaccinate the world, further pandemic waves and the emergence of new variants are inevitable. The African member states, therefore, reiterate the need for vaccine and therapeutic manufacturers to share intellectual property so that the scale and speed of production can be increased, with a focus on enhancing regional manufacturing for increased resilience and sustainability. Member states can greatly contribute to these efforts by sharing vaccine doses in good time, supporting COVAX, and removing any barriers to equitable distribution. During the course of this week, the African member states look forward to engaging in the discussions of the board, which is scheduled to receive reports from the working group on sustainable financing, as well as the working group on strengthening WHO preparedness for and the response to pandemics. With regards to the financing of WHO and the program budget, we concur with the various views review panels on the need to radically disrupt the way in which WHO is financed if we are to be better prepared to confront present and future health threats. We therefore urge member states of the executive board to take bold steps and adopt recommendations that will improve the financing of the organization and ultimately place WHO on a more stable footing as the lead UN agency for coordinating global health. We take note of the Secretariat's request for approval of an increase of $480 million in support of programs under the Emergencies Program and WHO's work on the prevention and response to sexual exploitation, abuse, and harassment. While we support the proposed administrative changes at both global and regional levels intended to inject greater oversight and accountability in ensuring that the allegations of this nature do not recur in the future, the African member states wish to underscore the importance of WHO maintaining focus on the needs of those most vulnerable through providing the required support to member states at country level in pursuit of their national, global commitments and the SDGs. In conclusion, the African member states takes this opportunity to congratulate member states for successfully convening the second special session of the Assembly and look forward to the updates of the establishment of the intergovernmental negotiating body during this executive board session. I thank you.
Thank you very much, Kenya. I now invite the distinguished delegate from Japan to please take the floor.
Thank you, Chair, for giving me the floor. Chair, fellow EB members, Director General, Deputy Director General, Regional Directors, Secretariat, Member States, delegations connected via Internet, and friends. Since it is my first intervention, I would like to join the Chair in wishing all the best for the healthier and safer year of Tiger 2022. Also, Japan would like to express our heartfelt sympathy to the people in the Kingdom of Tonga. Our thoughts are with those caught up in devastation caused by the catastrophic volcano eruption and the tsunami. We also miss our fellow EB member, His Excellency Minister Sayamao Piukala, who was not able to come to Geneva and working hard in alleviating suffering of his nationals. I have 3 points. First, Japan welcomes the DG report and appreciates his inspiring and visionary presentation we have just heard. We would like to thank Director General Dr. Tedros for his strong leadership and WHO staff for their consistent dedication and enduring efforts during the COVID-19 pandemic throughout the last 2 years. The Director General mentioned important landscape changes which affect how we work and what we target at. He continued to highlight many important progress achieved in the last year. And I congratulate all these achievements and wish to express our appreciation for the work of contributing staff member states, and healthcare workers on the ground. Second, the global COVID-19 pandemic has revealed the vulnerabilities and inequalities of our world and highlighted the importance of resilient health systems and universal health coverage. As the DG mentioned passionately, we must act now for the global achievement of UHC for a better, healthier world where no one is left behind. Thirdly, besides Japan being a strong advocate for UHC, we continue to commit to discuss on rebuilding a more robust global health architecture that is prepared and that is capable to prevent and respond to health emergencies. Member states have taken 2 key steps forward after the 74th World Health Assembly through the special session which to establish the intergovernmental negotiation body to develop a new international instrument on pandemic preparedness and response, and to discuss IHR strengthening, including through potential targeted amendments. Japan will stay active in both of these critical processes. Japan is also aware about the financing is one of the important pillars of reform. In this context, we commit with the idea of strengthening sustainable financing of WHO. We believe that simultaneous in-depth conversation between member states and the WHO to further strengthen its financial discipline and transparency will lead us to reaching middle ground, as Director General mentioned in the previous PB session. In conclusion, Japan affirms that addressing global health issues remains our top priority. We will work very hard in close collaboration and cooperation with WHO and member states for healthier and safer world. I thank you.
I thank the distinguished delegate from Japan, and now we invite Malaysia to please take the floor.
Honorable Chair, Director General, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Malaysia acknowledges the Secretariat and the Working Group on Strengthening WHO Preparedness and Response to Health Emergencies for their tireless efforts to find a global solution to address the weaknesses in healthcare systems revealed by this pandemic. Strengthening the implementation and compliance of the IHR must be a top priority. Malaysia supports the establishment of the Intergovernmental Negotiating Body to strengthen pandemic preparedness and response. We need to work together to restructure the global health architecture to one that is inclusive, accountable, equitable, and transparent to ensure the glaring shortcomings and inequity of the last 2 years can be avoided in the future. In the 3rd year of the pandemic, extended lockdowns and border controls should no longer be viable options as vaccines, vigilance, and community empowerment become more crucial in pandemic management. While the world is tired from the stop-start dance we have all been doing, we should also not assume that letting Omicron rip will bring about an endgame and not leave in its wake much death and damage. Malaysia has tried to respond in a calibrated and proportionate manner. We have implemented mitigation strategies to contain the pandemic while slowing down the impending Omicron wave without imposing harsh restrictions nor overwhelming our healthcare system. As we move forward, sometimes with different strategies, a normative consensus on how we all live with COVID-19 is necessary. The rise of Omicron has also underlined once again the urgent need to ensure equitable distribution and access to important tools needed to bring an end to this pandemic: vaccines, tests, sequencing, and therapeutics. Without resolving this great failing of humanity, it is likely that more variants can emerge as the virus spreads through vast segments of the world's population who are still unvaccinated. Malaysia has taken a whole of society approach in addressing the challenges of the pandemic. The government works hand in hand through public-private partnerships and with non-governmental organizations to ensure that everyone living in the country, regardless of their citizenship status, are entitled to a free, safe, and effective vaccine. Understanding the importance of real-time data sharing and the use of technology during the pandemic, Malaysia uploads comprehensive data sets daily. We upload individual anonymized line-listed details of every positive case. Malaysia's data is shared so we can all see actual world data on vaccine effectiveness, breakthrough infections, and deaths based on vaccine types, when the vaccines were administered, and other critical anonymized personal data. And through this, evidence-based information is conveyed to the public to reduce misinformation. We also need to share with and empower one another with best practices in using technology. Many of us have developed artificial intelligence applications for contact tracing, quarantine facilitation, digital proof of vaccinations and testing. We need to showcase the best practices of digital deployment during the pandemic. Malaysia would also like to raise the silent parallel pandemic. This is the deterioration of mental health. Lockdowns, movement restrictions, unemployment, and financial insecurity have led to a spike in the number of people seeking mental health support across the world. Malaysia has launched our National Strategic Plan for Mental Health, focusing on intersectoral collaboration and crisis preparedness in addressing mental health issues, including suicide, suicidal behavior, as well as surveillance for early detection of cases. Malaysia would like to commend the leadership of the Director General for fulfilling the mandate of WHO's work globally despite the resource-constrained environment. We recognize the dire importance to ensure sustainable financing, especially to carry out work for the shared vision of health in the Western Pacific region. On WHO's financing mechanism, we extend our appreciation to the working group and its members for the extensive work in long-standing consultations and robust discussion with member states in finding the best possible ways to improve the organization's finances. Malaysia urges that with the incremental increase in assessed contributions, the financial benefits should be equitably distributed and shared across all levels of the organization. Thank you, Chair.
I thank very much Malaysia, and now invite again the United Kingdom to please take the floor, to be followed by Singapore. The United Kingdom, the floor is yours, please.
Now?
Yes, perfect. We can hear you and see you. Thank you.
Thank you. Dear Director General and fellow delegates, the ongoing COVID-19 pandemic continues to underline the importance of global joint working, not least in accelerating equitable access to vaccines, therapeutics, and diagnostics. The Omicron variant has demonstrated the need to be continually vigilant, and we must continue to work collaboratively together to respond to future pandemics and other global health emergencies. I want to express gratitude to the WHO and the Director General for your tireless work in these unprecedented times, and for the work you continue to do as we respond to the Omicron variant, but also the wider health challenges you laid out in your report. We know that, like us, you are committed to learning from this pandemic and to reforming the global health architecture and mechanisms for health emergencies. We must recognize what works well, but also be ready to make reformative changes to ensure that WHO and the Executive Board continue to work effectively in coming years. It is particularly important that we address the long-running challenges associated with the unpredictability of WHO's financing and link this to clearer processes for agreeing priorities in which this board should play a key role. The work of the WHO special session at the end of last year was a vital step. We look forward to the creation of the intergovernmental negotiating body to agree a new pandemic instrument that will enable us to respond effectively to future global health threats. I know this week we will also discuss other important issues, such as ensuring the international health regulations work effectively. Another priority must be to focus on strengthening global surveillance to detect future variants or new health threats. The WHO's work through the International Pathogen Surveillance Network is a key part of this. We also recognise the critical importance of equitable access to medicines. This is why initiatives such as CEPI, along with other research and innovative global efforts, are critically important. The UK is proud to be hosting the Global Pandemic Preparedness Summit on 8th of March to support CEPI's replenishment. Clinical trials are playing a key role in tackling this pandemic, as the DG recognised, and we need to ensure that these are incentivised globally, and also that individuals who participate in trials are not disadvantaged when it comes to international travel. Whilst the pandemic is the focus of international attention, we must not forget the continued importance of other issues, not least the importance of strengthening country and regional health systems. The health threats from climate change and the silent threat of antimicrobial resistance, also recognised by the DG, as the latest estimates of global burden show, must continue to be central priorities for all of us. WHO should continue to work on the ongoing threats from global diseases such as TB, malaria, and HIV/AIDS, while supporting advancements in other important areas, including women's health, mental health, infection prevention and control, patient safety, and NCDs. We would also like to underline that tackling sexual exploitation and abuse is paramount. We are grateful for the work by WHO on this incredibly serious issue. We must continue to take action on these, as there should be zero tolerance of any abuse or exploitation. Finally, we wish to recognise the many health emergencies where WHO staff are currently working very hard. I want to particularly express our profound condolences to fellow board member Tonga. The UK looks forward to engaging with you all this week to ensure we drive better health globally to the benefit of all. Thank you very much.
Thank you very much, the United Kingdom. With apologies to Singapore, I would like to now give the floor to the Russian Federation, to be followed by Singapore. The Russian Federation, the floor is yours.
Уважаемый господин председатель.
Chair, Director General, colleagues, I wish to express thanks to the Director General for his report and for the productive work that's done in this very difficult period. The COVID-19 pandemic has posed a serious test to health systems and has shown that international mutual assistance and exchange of best practice is the basis for an effective system that allows us to respond to such a threat. That being so, a key role is played by WHO as the coordinator of international efforts to combat COVID-19, and we support further strengthening of WHO as a global leader when it comes to health. We attach great importance to the activities of the Member States Working Group on strengthening WHO preparedness and response to health emergencies. It is vitally important that the group confirmed the significance of the IHRs as the basic legally binding document that we have for issues of ensuring preparedness for health emergencies. We consider that one of the effective ways of enhancing the effectiveness of the provision of medical assistance in a time of pandemic is improving and strengthening a risk management system. A key part of such a system is the concept of clinical incidents that can then be broken down into the component parts of a problem. This allows us to respond more quickly. An incident management system of this type is today used in many countries, and it has proven to be an effective mechanism for response. We believe that introducing this kind of method would allow the WHO to respond more quickly and effectively to challenges. The Russian Federation supports the tasks that are set forth within the strategy to achieve global COVID-19 vaccination by mid-2020 and the targets therein. In other words, to ensure vaccination of 70% of the global population by the middle of 2020. In the Russian Federation, coverage is already very significant, and we note the timely work that has been done by WHO in that regard. We would, however, like to note in particular the quick response to the emergence and spread of the Omicron variant and the excellent communication and information work done. I wish to emphasize that the Russian Federation is willing to do its utmost in order to assist efforts to get to the 70% vaccination target, and that would include the delivery of production facilities and products for vaccination. We note also the work that is being done on medical and health indicators. And as things stand today, we see that more than 100 countries in the world have problems when it comes to looking at these indicators. And we are therefore willing to suggest that we organize some kind of methodological search, particularly when it comes to looking at the demographic indicators we have for mortality and morbidity. And certainly in Russia, we are one of the leaders in terms of developing a methodology allowing us to look at this kind of work, and we are willing to play a leading role in initiating work in this regard within WHO. We wish to commend WHO in particular for the work that was done in 2021. And we note that significant attention was paid to the issue of digitalization of health services. We think that really the COVID-19 pandemic has been a kind of catalyst for the development of the use of digital technologies in the health sector throughout the world. It's really been a unique opportunity for development in that area. We are therefore ready to continue to work and to play a leading role in taking forward the work that is done in this area also. In concluding my statement, I wish to note that a number of items are before us for consideration, especially the items relating to ensuring the financial sustainability of health care in the future. And this is a key issue for WHO and indeed for countries throughout the world. It's obviously a key priority for us, and therefore we would agree with what has been said by the Chair to the effect that this has to be one of our top priorities for our work today. In conclusion, I wish to extend my condolences to the people of Tonga, and I wish to thank all health workers who are actively involved in working on the front line with patients throughout the world at this very difficult time. Thank you.
I thank the Russian Federation and now invite Singapore to please take the floor.
Thank you, Chair. Singapore thanks Director General Dr Tedros for his address and his leadership. We watch with concern the developing situation in Tonga and hope that the resilience and indomitable spirit of her people will prevail. It's been over 2 years since the advent of the COVID-19 pandemic. While challenges still remain, especially with the emergence of new variants, we are now in a better position to take stock of our global and national responses, build on the achievements, and address the weaknesses. If you may, let me contribute 3 reflections on this. First, on strengthening WHO's preparedness for and response to health emergencies. A significant step was made with the member states' decision to establish an intergovernmental negotiating body to draft and negotiate a WHO convention, agreement, or other international instrument on pandemic prevention, preparedness, and response. However, we're aware that this is but the first step. The objectives of such an international instrument must be clear, the actions achievable, and the outcomes tangible in order to be meaningful. However, it's important to realize that how well the instrument is drafted or negotiated are not the biggest factors determining success or failure. Global health security rests on the collective actions of the individual member states. There must be greater emphasis on implementation, accountability, and transparency. Second, the issues associated with the underfinancing of the WHO have been magnified by the current pandemic. But the financing of the WHO has been a perennial problem even prior to COVID-19. To this end, we look forward to fruitful and frank discussions with the rest of the Executive Board and other member states on such issues. Lastly, the role of the WHO in the global health architecture. New structures and entities have been established or are in the midst of being proposed and established in response to the pandemic and the perceived weaknesses in the initial response. It is increasingly clear that the emerging global health landscape is no longer dominated by a few entities, but instead is made up of multiple actors. Debates on global health are no longer exclusive to the WHO. They are now regularly part of multilateral meetings such as the G20. While global health has greatly benefited from this pluralism, there is also an increasing risk of fragmentation. It is critical for member states to ensure that the WHO retains its leading, normative, and coordinating role for a healthier and safer world. Thank you, Chair.
I thank Singapore and invite France to please take the floor, to be followed by Denmark.
Thank you very much. Good morning. Chair, Director General, members of the Executive Board, dear colleagues. Let me start with expressing our deepest sympathy with Tonga. I am delivering this statement on behalf of the European Union and its 27 member states, the candidate countries, the Republic of North Macedonia, Montenegro, and Albania, the country of a stabilization and association process, and potential candidate Bosnia and Herzegovina, as well as Ukraine, the Republic of Moldova, and Georgia, align themselves with this statement. It has been 2 years almost to the day since you declared COVID-19 as public health emergency of international concern. The good news is that we have seen major scientific innovations with the development of mRNA vaccines. We have also seen a major drive in international solidarity with the delivery on January 16th of a billionth dose of vaccine via COVAX, and with the establishment of technology transfer hubs. It remains, however, worrisome and challenging that, on the other side, the number of new cases is still at record levels. Too many countries have not yet been able to reach the vaccination targets, insufficient access to medical countermeasures, and the fight against COVID-19 has led to the neglect and exacerbation of other health issues. Our common goals remains to bring this crisis to an end as quickly as possible. The EU and its member states are fully committed to supporting the global response to the COVID-19 pandemic. The EU has already exported 1.4 billion doses of vaccines to over 150 countries and will donate 700 million doses by mid-2022. To ensure that we can move from vaccines to immunization worldwide, we must do more. We are not on track in achieving the global goal set for mid-2022. We must rise to the challenge. Let me now switch to French. L'architecture sanitaire mondiale a souffert.
The global health architecture has suffered a great deal in recent years. Yes, we have stepped in to make up for shortcomings, but more remains to be done. The EU was resolute from the beginning in supporting the idea of having some kind of treaty to deal with pandemics, and we are in favor of modernizing the IHRs and updating them. We are also calling for the strengthening of WHO's role in leading and coordinating international health work in cooperation with partners. Increased efficiency through streamlined governance, accountability, and an executive board that is committed to increased transparency and swift decision-making. These will be key factors in this endeavour. Sustainable financing also needs to be at the heart of this strengthening process. We cannot ignore the chronic underfunding of the organisation, something that hampers its ability to step up to member state expectations. Director General, you can also count on our mobilisation to make progress in achieving the other health-related sustainable development goals. COVID-19 must not be a pretext for justifying delays. It must rather be a catalyst. The pandemic has made us aware that health is a condition for the proper functioning of our societies. It has been a stark reminder of the importance of resilient health systems and of the true value of the work done by health workers. The pandemic continues to illustrate the dramatic consequences of a lack of access to primary health care, especially for children and for women with regard to sexual and reproductive health and rights, as per the new European Consensus on Development. The pandemic calls for the establishment and implementation of a One Health approach that takes into account the interface between human and animal health and environmental factors. Finally, in terms of collateral damage, the pandemic is a cruel reminder that NCDs remain the main cause of morbidity and premature death in the world. Let's find together the means and ways to reach the SDG target of reducing premature mortality from non-communicable diseases by 1/3. Thank you.
Je remercie la France et je invite
Thank you. Denmark, please.
Thank you very much, Mr. Chair, dear colleagues on the Executive Board, dear Director General. Denmark fully aligns itself with the statement just made by France on behalf of the EU and its member states. As a new member of the Executive Board, I would also like to express my sincere appreciation for the leading role of the WHO in the global response to our shared health challenges. These past years have not been easy. The COVID-19 pandemic has exposed the vulnerabilities within our countries and our societies, but also within this organization. Nevertheless, the crisis has also united us by further emphasizing the importance of multilateral collaboration. Together, we have made the impossible possible with the prompt development of safe and effective vaccines against COVID-19. It has become evident that multilateral cooperation is an essential part of overcoming a pandemic. The adoption of the decision to establish an intergovernmental negotiating body to strengthen pandemic prevention, preparedness and response is also proof that we are able to stand together in times of crisis. We must share important knowledge and learn from our experiences within the current epidemic, as there is still work to do in making sure that we are prepared to deal with future health emergencies. However, for the WHO to maintain its leading role in global health, we must not lose sight of the many other health challenges prevailing in our societies, some of which have been severely worsened during this pandemic. Just to mention the prevalence of antimicrobial resistance, the rise of non-communicable diseases, and the increasing negative consequences of poor mental health. These are only some of the huge challenges we face together. The pandemic has reminded us that health is a prerequisite for the functioning of our societies. The very extensive agenda underlines the ambitions of the WHO to make health and well-being a global priority. As we prepare for the World Health Assembly in May, let us continue to stand together in fighting this pandemic, while also aspiring to make our populations healthier, challenge by challenge. I look forward to a constructive meeting. Thank you very much.
Thank you very much. I now invite Guyana to please take the floor. Thank you.
Mr. President, Director General, and distinguished delegates, as we gather for the Executive Board meeting, we are in the third year of one of humanity's worst pandemic, the COVID-19 pandemic. Guyana extends our gratitude to the Director General and his staff of the WHO. They showed remarkable leadership in responding to a virus that has challenged our development, challenged our scientists, challenged our hospitals in ways that are unprecedented. As tragic as these consequences are, we also carry long-term scars, such as on people's physical and mental health and on people's lives and livelihoods. The consequences of COVID-19 have been worsened by the impact the virus has had on human resource, on transportation, on the supply chain. They have affected the response to the COVID-19 crisis itself, but will have socio-economic consequences for a long time to come. One of these consequences is the learning losses in our children. Another is the impact on children vaccination rates. The fight against HIV, TB, and malaria are also impacted. So too has been the fight against the NCDs. And so too is the fight against climate change, which is already severely affecting countries like Guyana and many small island developing states. The fact that even in poor countries, health workers have been able to preserve much of the health gains we have made in the last 2 decades is testimony to the tremendous commitment of doctors, nurses, and other healthcare providers. And Guyana takes the opportunity at this executive board meeting to register our gratitude, not only to the Guyanese health workers, but to health workers across the world. The fact that as we meet, developing countries have had a difficult time accessing vaccines, medicines, and other supplies necessary for an effective response to COVID-19 should compel us to more stringent actions to overcome inequity. It is not right, distinguished colleagues, that more than 85% of persons living in Africa are not yet able to obtain at least 1 dose of vaccine. Guyana wants at the same time to register our gratitude to the WHO and COVAX, and to the countries like the UK, the US, the countries in the EU, Canada, India, and China, and Russia for their support in rolling out our own vaccine program. But without formal equity system, the targets under SDG 3 and others cannot be obtained. UHC is impossible unless the global inequity narrative undergoes a drastic rewrite. As the DG reported, more than half of the global population lack access to UHC. In this regard, Mr. President, distinguished delegates, electronic medical records have proven to be a critical component of effective medical system. There are too many countries not benefiting from the involvement, improvement, and availability of information system technology. The vast majority of the global population are outside of high-quality electronic medical records. We thank the DG for highlighting the problem of substance abuse. Substance abuse is an ongoing pandemic. Guyana is one of the many developing countries that is building a capacity to respond to substance abuse, as highlighted by the DG. Mr. President, Director General, distinguished delegates, as long as production and certification are controlled by only a few countries, as long as there is not a fairer intellectual property right regime, equity will be the victim of hegemony. We urge the WHO to intensify efforts to bring production of essential medicines and supplies much closer home in developing countries. In conclusion, Mr. President, Director General, distinguished delegates, the WHO has accumulated an impressive track record over 7 decades. The time has come for a new approach. The One Health agenda cannot wait. I wish the 150th session much success in our deliberations. Thank you.
And we thank you in return. And with that, I now invite Argentina to please take the floor, to be followed by Belarus. Argentina, the floor is yours, please.
Muchas gracias.
Thank you. Thank you, Mr. Chairman. I actually thank the Director General for his report. You shared some very encouraging data in some areas and also great challenges in others. I'm here not only as Minister of Health of Argentina, but also as a member of the EB representing the region of the Americas. And as others, we would like to express our condolences, our solidarity with our brothers from Tonga and hope for a rapid recovery in their country. My country is in one of the regions hardest hit by the pandemic, with enormous impact on health, economy, and also social and political areas, adding to the inequalities that already existed prior. As we know, the emergency has hit harder those groups which were already in situation of vulnerability, converting these structural inequalities into access gaps to economic, social, and health rights. Women, girls and boys, adolescents, old persons, the collectives of diversity, people in situations of poverty, informal workers, migrants, refugees, persons with disability, among others, are some of the most affected groups affected by the pandemic, and they need priority attention. We would like to express our great recognition to the work of health workers. Mr. Chairman, Argentina is committed to the process of strengthening the health emergency preparedness and response, the strengthening of the WHO, and fulfillment of the international health regulations. And this is why we plan to take part with commitment in the international negotiation of a new accord in complement to existing instruments to onboard the lessons left by the pandemic. Nevertheless, we must underline the lack of equitable access to essential goods such as medicines and vaccines, which has characterized the global response to the pandemic. Despite the efforts being made, we celebrate the progress that has been made in COVAX, and we see that there has been more vaccines put forward in the last month than over the 2 months prior to that. This is not the first health emergency in which medicines and vaccines have distributed unequally among the different regions of the world. We saw this first with the antiretrovirals for HIV and during the epidemic of H5N1 flu with vaccines against pandemic flu H1N1, and we see it once again with this current pandemic. We'd like to recall that 20 years ago, the members of WTO raised through the Doha Declaration on Trade-Related Intellectual Property Rights and Public Health, 2nd of October 2020, India and South Africa, with the support of Argentina, a communication for suspending implementation in fulfillment of certain provisions related to COVID-19 for the duration of the pandemic. And we made this request more than a year ago, and it has still had no response. There have been huge difficulties initially to have access to vaccines, but Argentina has now achieved 74.5% of the population with full vaccine coverage, which is beyond the goal established by WHO for June of this year, thanks to the tireless efforts of the vaccine campaign and the great confidence of our population in the vaccines. Nevertheless, we feel it's important that we increase efforts so that every nation achieves these goals. Our country is one of the few which has decided to vaccine children from 3 years of age, and to date we have protected more than 77% of girls and boys and adolescents from 3 to 70 years of age with 1 dose and 56.6% with the full coverage. Finally, since October 2021, we've been working for promoting a strategy for strengthening the understanding of the benefits of vaccines for overcoming illness and deaths. This is why inspired by the principles of equity, cooperation, and solidarity, in Argentina, initiate a process of donating vaccines through Latin America, the Caribbean, Asia, and Africa. We have given more than 5 million doses, convinced that we will not manage to turn the page on this pandemic, the major crisis of this century, until we have equitable access, with the aim of overcoming regional and also global vaccine gaps. We have been working together with AstraZeneca and Sputnik for national, and we also have national production of 4 candidate vaccines. We're working on the clinical phase and collaborating with the production sector at a national level. We're proud to have been selected, along with Brazil, for the creator of 2 development and production vaccine centers for mRNA vaccine technology, which is another step forward for the region of the Americas. We clearly believe in strengthening local production and of health technologies and increasing scientific and regulatory national capacity through transfer of technology, access to financing. These are absolutely vital so that we have access to consumables and countermeasures. Having said this, we joined with Brazil and South Africa for the Global Strategy and Plan of Action on Public Health, Innovation and IP, intellectual property. And we'd like to thank all the member states who stated their interest in co-sponsoring this. In this framework, and with a priority of a progressive strategy, primacy of care, an approach based on the community and scientific evidence, we are looking for federal agreements for our actions. And this is why we believe that the lacks that we see in mental health and the impact of the pandemic on mental health require a cross-cutting intersectoral community approach to mental health, psychosocial support in emergencies, promoting specific capacities and specific plans for attention for workers who are frontline response workers and on their mental health. And for the first time, our basic remedies box provided by the government includes mental health medicines. And we are looking at this issue at a national level. Mr. Chairman, the focus on mental health and psychosocial support needs to become a cross-cutting axis and move the focus away from fighting illness to looking for resources and protection and promotion of health. Without mental health, there is no health. And without mental health, we don't have social inclusion. Finally, I'd like to refer to the note sent by the World Federation of Public Health Associations on behalf of the Sustainable Health Equity Movement to members of the EB, asking that through this EB, the Assembly evaluate the need of requesting the 77th UN General Assembly to have a high-level meeting on a multi-determination integral response, coordinated response to the COVID-19 pandemic in September 2020. This event would have the objective of facilitating participation of heads of state and government with the aim of analyzing the multidimensionality of the COVID-19 pandemic. Finally, we'd like to reconfirm our commitment to continue working at a regional and global level on those health challenges which require joint efforts by the international community. And especially, we'd like to call on all those present, physically or virtually, to give the Assembly the guidance that it requires at such a crucial moment. Now 2 years since the start of the beginning of the pandemic. Mr. Chairman and Director General, you can count on Argentina to help overcome the health challenges of the pandemic and particularly to work for the right to health to make a tangible improvement in people's lives.
Thank you very much, Argentina. I now give the floor to Belarus, to be followed by Austria. Belarus, the floor is yours, please.
Спасибо, господин председатель.
Thank you, Chair. We would like to thank the Director General for his comprehensive report delivered to this EB. And it's clear that health has become a key issue for the world today. And there are indeed a number of outstanding issues and challenges that we have yet to grasp. And this is clearly a priority for global policy, especially when it comes to sustainable development. We support what the WHO Director General is trying to do in adapting the organization to contemporary realities. We wish to support the idea of enhancing the role and the capacity of the organization, in particular by making it more easy for WHO to respond to global health emergencies. We support the intergovernmental process that is underway in seeking to bring that about, in particular the work done by the IPPR. We do indeed intend to participate most actively in the ongoing process and in the work in the future. At national level, we have done a great deal in seeking to combat the challenges of COVID-19. Undoubtedly, we are convinced that we must recognize that we have to deal with this pandemic in a universal context, but nonetheless, each of us is dealing with the challenge in a national context. We are all dealing with it in our own country, part of the big picture, yes, as the Director General said. We, therefore, recognizing that, have sought to promote the greatest possible level of protection for the people of our country and to ensure that we can give also at the same time appropriate protection to our economy, because we do know that we always have to create a proper balance and that this is important in order to ensure the sustainability of our health sector into the future. That being so, we have been very careful in our approach, and as has been said by many others, we have undertaken an active vaccination campaign, and we have reached very high levels of vaccination. We have worked with our partners, particularly in vaccinating people with the Sputnik V vaccine, and we are working also on developing our own vaccines. And we certainly will be more than ready to share that vaccine with countries in need of it. Let me just emphasize once again that we do recognize we are doing what we can, but we want to be part of the global effort to combat COVID-19 under the leadership of WHO. Thank you.
Thank you very much, Belarus. I now invite Austria to please take the floor, to be followed by Timor-Leste. Austria, the floor is yours.
Thank you, moderator. Dear Chair, Director General, honorable delegates, I'm aligning myself with a statement made by France on behalf of the European Union and its member states. I would like to congratulate the DG on his report and like to confirm the strong support he needs from us member states to further achieving our missions to strengthen global public health and overcoming the threats of this ongoing COVID-19 crisis. This time I will refrain from commenting the work of COVAX and the problems we are all observing. Other members of the EB might be in a better position to do so. I rather would like to emphasize the point the DG made on a renewed global architecture for health emergencies. In creating such a new global architecture, we should avoid any motion of further fragmenting the responsibilities and competences when it comes to deal with matters of health emergency. We don't need additional structures, especially when we would lose inclusivity for all member states and transparency. Health emergencies are not issues for a few large and wealthy member states. It is a matter for all of us, regardless how big or small a country is. And I think we shouldn't forget that moment, that this inclusivity and transparency is of utmost importance. Having said this, I would like to call on the DG to come up with a proposal for such a new global architecture for health emergencies at the World Health Assembly in May. As fast as we, WHO, are moving on this, other interested potential partners are losing momentum in drawing up such an architecture. Director General, we, the WHO, have to defend our role as the competent authority when it comes to public health and health emergencies. WHO role is to include other sectors. Yes, a so-called cross-sectoral approach is necessary, but this has to be done under the strong leadership of WHO. Director General, I call on you to act in this direction and be sure of our support, and we do have to discuss that at the World Health Assembly. Let me conclude that I also would like to echo our condolences and sympathies for the hardly hit people of Tonga. Thank you very much.
Thank you very much, Austria. I now recognize Timor-Leste. Timor-Leste, you have the floor, please, to be followed by Slovenia.
Mr. Chairman, Director General, Regional Director, fellow members of the board, Excellencies, I take the opportunity to wish Director General, Regional Directors, that said, and all members of board and the member states healthier, greener, and a safe new year. I join you in extending our condolence to fellow states country of Togo, which suffered from recent tsunami. Timor-Leste wishes to thank and compliment and congratulate Director General for a very comprehensive and analytical report. I comment and applaud Director General for exemplary leadership and standing timely and technical advice for COVID-19, but also for maintaining essential health service during COVID-19 times. The last 2 years have been unprecedented. The health system, the government, and the people of Timor-Leste have been tested like never before. It was timely technical assistance and extensive support from regional and the country office in Timor-Leste that has enabled Timor-Leste in managing the COVID-19 pandemic, but importantly for COVID-19 vaccination. We are surging ahead in COVID-19 vaccination, drive with more than 84% for the population having received 1 dose and 70% with second doses of COVID-19 vaccine. The support of WHO and our partners in securing and administering vaccine have been phenomenal. Mr. Said and the Director General, expanding health security to strengthen social security, especially for vulnerable remains, silence, and the WHO leadership has been exemplary in addressing this. We look to continue support and assistance so that we leave no one behind. Health system resilience is not possible without a strong emergency and a critical case system. The pandemic has highlighted this gap as one of our immediate and first priorities. We take note of increasing use the digitalization in health and highlighted by Director General as we look to work with WHO to capitalize on use of the data for decision making. For all these priorities and more, we look to continue our strong relationship of trust, respect, and support with WHO onwards and forwards. I thank you.
Thank you very much. I now have the pleasure to invite Slovenia to please take the floor, to be followed by Colombia.
Thank you, Mrs. Chair. Excellencies, ladies and gentlemen, I would like to align myself with the statement made by France on behalf of the European Union and its member states, and would also like to express my sincere condolences to people of Tonga. I thank you, Director General, for your excellent report and for the 5 priorities that you have shared with us. We all understand that change is needed. This has also been shown by the proliferation of initiatives and ideas on how to reform the global health architecture. Some initiatives we have participated in, such as the Great New ACTA and COAS. Some, however, are being discussed behind the doors open to only a few. We are convinced that all new ideas aiming to improve global response to health threats are worth considering, but we also firmly believe in engaging in a truly multilateral fashion where all of us have a say. WHO has always been such a platform, and it should continue to play a central role and the leading role in all reforms of the global health architecture. The COVID-19 pandemic has shown that more solidarity and improvements of global mechanisms for preventing and responding to health emergencies are needed. It has also shown that there is a need of health system strengthening at the global level. For many years now, the European region of WHO has had a strong focus on strengthening health systems, and in particular on strengthening primary health care. Many innovative solutions have been developed and shared within cooperation with WHO Euro and with the support of evidence and analysis provided by European Observatory on Health Systems and Policies. These investments have in many ways paid off during the pandemic. We should aim and work together, share among the regions to make a change and find the ways for strengthening health systems globally. While much has been achieved, NCDs still represent a global challenge to health systems, especially those that result in the highest burden are largely preventable. These remain an untapped source of potential. Yet, only a trifle of healthcare spending goes to preventive services, and too often we are hesitant to adopt effective policies to address health determinants and risk factors. Change has always been difficult to accept and implement, but it has never been as urgent as it is now. The world is changing fast and in many dimensions. This requires quick and efficient response of us in health sector, a new vision, as you said, Director General, and better understanding also of our populations. Finding appropriate and timely solutions globally where nobody would be left behind, we believe, can best be done by working together within our collaboration in WHO. Thank you.
Thank you very much, Slovenia. I now invite Colombia to please take the floor, to be followed by Oman.
Thank you, Mr. Chair, Director General, Mr. Secretary, Your Excellencies and colleagues, and everybody connected all over the world. Good morning, good evening, good night. I'm going to switch to Spanish.
First of all, we would like to express our solidarity with the people of Tonga. We would like to convey from the people of Colombia all our solidarity and our condolences. Secondly, we agree with the vision and the goals which have been outlined today by the WHO Director General in his opening statement, and we applaud the efforts of the organization to make them a reality. Colombia agrees with the target of vaccinating at least 70% of the world's population. At the moment, 80% of our population has had at least one dose of vaccine. 60% have been fully vaccinated, and we hope that before we come to the end of the first year of implementing our national vaccination plan, we will have achieved the target. At the same time, however, we would like to share our concern at the vaccination gaps which we see in many regions of the world, making it almost impossible for them to achieve this target. If the target is to be hit, we think that we need to make considerably more effort and to consolidate our efforts under the coordinated leadership of the World Health Organization. This will mean all countries must commit themselves to equity and fairness in the distribution of and access to COVID-19 vaccines. As one of the co-chairmen of COVAX, we would like to take this opportunity to express our pleasure at the recent increase in the distribution of COVID-19 vaccines through COVAX, particularly to the most vulnerable regions of the world. We hope that in 2022, we will be able to increase these efforts, particularly for the benefit of the low and medium income countries, because those in Africa and in the Americas are in the most difficult situation. We would also like to draw to the meeting's attention one or two other points to which we attach particular importance when it comes to achieving our vaccination goals, and that means not only production of vaccines, but also the development of the necessary infrastructure required for vaccination campaigns such as human resources training and maintaining the cold chain effectively in countries receiving vaccines. There's also the issue of vaccine hesitancy getting in the way of vaccination coverage, and further information work has to be done in order to tackle this problem. We applaud the transfer of technology, particularly on messenger RNA in various countries of the world, including in Latin America and including, of course, South Africa. We do hope that we will be able to extend this transfer of technology to many other countries and regions in the world in the short and medium term. In conclusion, Colombia would like to express her support for the agenda set forth by the WHO Director General for the next few years and for the next decade, and we intend to be an active participant in carrying out that agenda for the well-being of the people of Colombia and the people of the world. Thank you very much.
Very much, Colombia. I now invite the distinguished delegate from Oman to please take the floor, to be followed by Burkina Faso.
Thank you very much, Mr. Chair, ladies and gentlemen, dear colleagues everywhere. Assalamu alaikum wa rahmatullahi wa barakatuh. To start with, I would like to express our deepest condolences and sympathies to the people of Tonga, wishing their country a speedy recovery. Dear DG, thank you very much for your comprehensive and informative report and for your leadership, not only during the pandemic of COVID-19 crisis, but through all your work, and I can assure you of my country's support to you and to the organization. I would like also to take the opportunity to thank all WHO staff worldwide for the excellent effort and work they are doing. Also, I would like to register our thanks to healthcare workers everywhere. They've been heroic, they've been doing an excellent job, and some of them under difficult circumstances, knowing that in many countries, healthcare staff did not have access to personal protective equipment, therapeutic, diagnostic, and of course, many of them are still not vaccinated. And here, I would support the call for equitable access to all health goods, including what I mentioned above. In Oman, we were hit hard also by this pandemic, like many other countries. We've tried to manage it without disrupting life as much as possible. And luckily, and with the support of His Majesty's government, we managed to vaccinate more than 90% of our targeted population. Also, the lesson that we've learned from this pandemic hopefully will help us to manage our healthcare better. We started virtual clinics, drive-through pharmacies, and many other initiatives. And thanks to our strong primary healthcare services, we managed to maintain many of the essential services, particularly our vaccination program, which we are very proud of, which covers between 99% to 100% of our children. We support the initiatives to reform WHO, and the basic and the most important one, sustainable financing. Without that, I don't think we can expect from this organization to carry the tasks that we want them to do. Also, in finding a new tool or treaty or whatever we'd like to say it to manage pandemics, I think it's essential. This is not going to weaken IHR. For me, it's the opposite. It might strengthen IHR. And here I would like to call on the world community to work together, not only to manage this pandemic, but also to try and prevent the future ones, which are unfortunately inevitable. I'm grateful to the DG for mentioning antimicrobial resistance, and to my colleague from Denmark and many other countries. This is a very alarming issue. As the DG mentioned, 4.1 million people lost their life due to AMR last year. It's expected, if we don't do anything different, by 2050, there will be 10 million unnecessary deaths due to AMR, and that's more than road traffic accidents and cancer combined. And here, I'm pleased to tell you that we are hosting in Oman on 28th of March this year, the third International Ministerial Summit for AMR, and I would like to see your participation. Thank you very much again, and I wish you a pleasant and informative meeting. Thank you.
And we thank you in return, distinguished delegate from Oman, and I now invite Burkina Faso to please take the floor, to be followed by Tajikistan.
Merci beaucoup.
Thank you very much, Chairman. On behalf of the African Group and on behalf of Burkina Faso as an individual country, I'd like to offer our support to and sympathy for the people of Tonga, currently having to deal with a dreadful natural disaster. You have Burkina Faso's support and the sympathy and condolences of the African Group. I'd also like to address my thanks and congratulations to the Director General for what was a very precise and detailed report, which gives an excellent picture of the current state of the world's health. It also, equally important, highlights the problems that we have to tackle if we want to build on what we've achieved in the future. As to the setting up of an intergovernmental negotiating group to strengthen pandemic preparedness and response, let me say that we support the statement that Ghana will be making on this on behalf of the African Group. We would also, however, like to make a suggestion if somebody else hasn't already done it, and that is that we take into account as an element in this the issue of palliative care. That means training people to provide palliative care. That's certainly a problem in Africa, but also financing and the provision of related health technology and medicines. There are other issues, but these are the most specific ones. When it comes to emergencies, we need to have an emergency reaction. I think that goes without saying. And that means that the work of the group, in our opinion, needs to be tightened up. 3 years is a little bit long to produce results, in our opinion, and to decide what action to take in respect of this. And therefore, we would like the work, if possible, to be completed in 1 year so that implementation could actually begin next year in 2023. Those are the points we wanted to make in our contribution. Thank you.
Thank you very much. I now give the floor to Tajikistan, please, to be followed by Grenada.
Thank you very much, Chairman. Chairman, Director General, distinguished members of the Executive Board, and all other participants of this 150th Executive Board session. I'd like to begin by conveying my gratitude to the Director General for his report and for specific and very important proposals about strengthening the global health system. The pandemic has flagged up the inadequacies and the problems in the international health system, and obviously they're going to require the international organizations dealing with health at regional, national, and global level to make adjustments in the way they work. A great deal, obviously, depends upon the financing of the global health system, and here we support the proposal made by the Director General. We hope that if we act on it, we will strengthen global health as appropriate in the immediate future. I'd like to underscore the hard work done by WHO on COVID-19 vaccination and on strengthening primary health care. I'd also like to take this opportunity on behalf of Tajikistan to express our deepest condolences to the people and government of Tonga. Thank you.
Thank you very much. I now give the floor to Grenada, please.
Thank you. Chair, let me start by recognizing and congratulating you in your role, and also join you and our other colleagues here in offering support to our brothers and sisters in Tonga. Director General, I congratulate you for your delivery as well, and most importantly, for your support throughout this pandemic. That of your team as well. I would like to join with you in your calls and the calls of many for vaccine equity throughout the world, as this is the only true way out of this pandemic. I also join you and support you in your calls for AMR as well, and in particular for non-communicable diseases, which is our new and continued plague. And Grenada would also like to make a call for further support for vector-borne diseases and the neglected tropical diseases. Thank you.
Thank you very much. I now give the floor to Peru, please.
Microphone, Peru, please.
We have a little technical challenge. We'll take 1 second to resolve it, and I think that we have thumbs up.
Thank you. I'd like to convey my greetings to the WHO Executive Board as Health Minister of Peru and a titular member of this body. The main challenge for the World Health Assembly and the World Health Organization at the moment are obviously constituted by the global COVID-19 crisis. We are one of the countries that has suffered worst from the COVID-19 pandemic. We have one of the highest mortality figures per million inhabitants, and we have a health system which has been neglected, unfortunately, for decades. In that state of neglect, it had to face a global pandemic. So I suppose the level of mortality we've had isn't that much of a surprise, unfortunately. We've been in power now for almost 6 months, and in that time we have been trying to do our best to return the security of better tackling the COVID-19 pandemic to the country. We have changed our strategy, and we have tried to bring the Ministry of Health closer to the population. We've gone from house to house, we've gone into workplaces, we've held public meetings in order to convince people of the need for vaccination and accept the vaccine. We've had some very interesting things done to mobilize people locally on a regional basis, and the outcome on the whole has been positive. We've also worked, of course, alongside our people in the health sector. We've got about 89% of the population over 50 years of age now vaccinated with 2 doses, and over 56% of that same population group, which is the most vulnerable, obviously has now had its booster as well. So we've made progress, and that progress has enabled us to bring down the mortality rate a lot from what it was in the first and second wave. However, we still need to make more progress with the health system as a whole to improve and strengthen it. We saw what happened in the first and second wave then. People did not have the opportunity to protect themselves properly or to organize in order to tackle the danger of the pandemic. Since then, we have managed to do better, bring people together within countries and bring individual countries together in order to protect the most vulnerable. Having said that, not everyone's received the vaccines, and if they have, sometimes they haven't had the technology and the infrastructure enabling them to tackle COVID-19 as well as some other better equipped countries have. So everyone's had equal opportunity to get COVID. Not everybody's had equal opportunity to protect themselves against COVID. It's therefore essential that the WHO and other international organizations make more progress on strengthening and building solidarity and equity in respect of healthcare and access to healthcare across the world. I welcome what WHO has already done to tackle vaccine inequity. It has done a great deal, but unfortunately, we still seem to be bargaining, negotiating, and trading over COVID-19 to a certain extent, rather than being beacons of solidarity in tackling it. We're all going to need equipment, vaccines, reagents, technology, if we are to make our people safe and ensure that they can enjoy the right to health to which they are entitled and which they so badly need. Having made those points, my greetings again. I wish you and all of us success in achieving and guaranteeing the right to health and defeating the pandemic. We support the redistribution of surplus vaccines that countries do not need or are not using. Some countries do have a surplus, I know, and if that is the case, we urge them, and that includes us, to redistribute them, to donate them, which is what should be done, to those countries that desperately need them and can make best use of them. My country and my government are determined to stand shoulder to shoulder with all of you to defend and protect health and defeat COVID-19. We would like to see it disappear, I'm sure we all would, and if that means greater solidarity and fraternity, then so it should. Thank you.
Thank you very much. I understand that you, Mr. Chair, would like to have the floor for a moment. Thank you.
Thank you, Secretariat, for moderating that session. I would like again to give the floor back to the Secretariat to be able to make some administrative announcements. Secretariat, please.
Thank you, Mr.